Can diabetes cause blindness? People with diabetes are often unaware that they may be putting their eyesight at risk. In this video, Full Body Health discusses the effects of diabetes on your vision. Diabetes can cause many problems, but it's important to know that one of them could be blindness. Watch my video today for some helpful tips on how you can protect your eyesight while living with diabetes. It's been found that people with diabetes are more likely than others to develop an eye condition known as diabetic retinopathy, in which blood vessels in the retina become damaged or leaky over time, leading in some cases to blindness. People with diabetes have 3 times the chance of going blind compared to someone without it. In addition to having problems with your vision because of diabetes, you will also have to endure other sight-related issues such as cataracts and glaucoma. Let's take a look at the reasons why diabetes causes blindness, in addition to other eye conditions. In addition to being one of the leading causes of blindness in America, diabetes can also cause blindness in other ways. There are 2 main types of diabetes, type 1 and type 2, which both affect the way your body handles blood sugar. If you have either type 1 or type 2 diabetes, it's important to do all that you can to help control your blood sugar levels, so that this doesn't happen to you or someone close to you. Type 1 diabetes. This is where the body stops creating insulin, so it is vital for people with type 1 diabetes to take daily shots of insulin in order to maintain their health. Otherwise, they will die shortly after diagnosis. With type 1 diabetes, the immune system destroys the cells that create insulin, meaning that there isn't enough insulin in the body and blood sugar levels increase, causing all sorts of health concerns. If you have type 1 diabetes and your blood sugar is too high, this can damage the cells in your retina and cause serious sight problems, such as diabetic retinopathy, a common complication of diabetes that affects your retina's function and can even lead to blindness. Type 2 diabetes. This is when the body produces insulin, but does not use it like it should, meaning that there will still be glucose in the cells, which becomes toxic over time, called hyperglycemia. This type of diabetes is most commonly brought on by obesity and old age, which make it harder for the body to keep up with the amount of insulin needed to maintain proper blood sugar levels. Even though they might not be diagnosed with type 1 diabetes, people who are insulin resistant are more likely to have higher levels of blood sugar because their bodies are still trying to produce insulin, which is not working at its optimal level. If you have this type of diabetes and your blood sugar is too high, over a period of time, it could damage the cells in your retina, leading to diabetic retinopathy or even blindness. When someone has either type 1 or type 2 diabetes, they need to stay diligent about monitoring their blood sugar levels because any little bit helps. The American Diabetes Association recommends that diabetics get their eyes checked once every year by an optometrist or ophthalmologist, but if you notice that you are having difficulties seeing, go ahead and set an appointment with your doctor sooner rather than later. Remember, having diabetes does not mean that you will go blind, just because it is a possibility, but with proper monitoring and treatment, there are ways to prevent it from happening, or at least minimize the risk of losing your eyesight in the future. If you are suffering in diabetes, please like this video and share your thoughts in the comment section, and subscribe to Full Body Health for more health information. Thanks for watching.